We know that relapse is often part of recovery. Why is that?
It's not as straightforward as we like. If you get an infection, you take an antibiotic. Hopefully the infection goes away. Just so happens that addiction isn't that kind of disease. It's similar like diabetes or any type of cancer, like a melanoma. You treat it like with insulin or with chemotherapy. You may get better, but then you may make a lapse or relapse and things may get worse and you have to treat it again and kind of repeat the process. So in the same way for addiction, it's just a reoccurring disease that has to be retreated. Sometimes you have to treat it differently. With melanoma, you want to cut it out. You may want to do radiation. Similar with addiction, sometimes you want to give like opiate maintenance kind of therapy, or you want to go to inpatient rehab, or you want to go to a recovery program. So you may always want to change the treatment, but you're still treating the same disease.
You told me when we were talking earlier that recovery needs to become a habit in the same way that drugs and alcohol were a habit.
Right. With kids, it's easier to stop the problem or stop the pattern of addiction because it's typically only been going on for so long. But once they get older, they started when they were 14, now they're 23, 24. You're looking at close to 10 years of them doing that particular habit. And then when you do something for that long, it develops a lot of layers to it. It's almost like an onion where, to start, you did it with your friends, and then that led you doing it while you're watching TV, that led you doing it while you're playing sports, while you're having sex, while you're spending time with anyone, while you're doing work, and it just becomes so ingrained in your daily activities. To not do it, it feels kind of weird. So our job as recovery specialists or addiction specialists is really try to unravel that knot and get them to realize that, one, it's not necessary to have fun. You could certainly, watch a movie, have fun without the substance. You can certainly go to a party and have fun without the substance. But since they've been doing it that way for so long, it's really difficult to break the habit.
So it's almost like flossing your teeth, right?
Exactly. If I go a night without flossing my teeth, I wake up in the middle of the night and I have to floss just because I feel weird, So, and it's the same thing. And if you go every night before you go to bed, you have a nip of alcohol or whatever, and you've done that for however many years, it takes more than someone telling you that it's bad to stop doing it, right? So if you like Oreos and you eat Oreos every single night and someone tells you you're going to get diabetes if you continue to eat Oreos, it's one thing to hear it, another thing entirely to do it, to break that habit.
And that's the tricky part of this.
Yeah, Oreos are delicious, so it's difficult. Yeah.
You've said it's like a double whammy because it's the routine and the preparation of using drugs, which brings on euphoria. And then the actual drugs bring on euphoria. And now there's no euphoric activity.
Right. So a lot of people say whatever their substance was, whether it's marijuana or cocaine or heroin, the process of getting it before using it brings on its own state of euphoria and ecstasy and relief. And that's even before using. And then we use, and obviously that perpetuates the cycle. So if someone has an issue that's so ingrained and they love the process in and of itself, you can see how it's difficult to stop them from doing that because that's even before they're using it. So you're not only trying to stop them from using the substance, you're trying to stop them from using all the habits and behaviors that led up to them using that substance.
I can identify with that. It became a ritual for me to sit at my makeup desk before I went out for the night with my glass of vodka, which had been in the freezer, getting nice and ready to sip. And then I would take out my little bag of cocaine and chop it up, make the lines, and I would drink my alcohol and sniff my cocaine as I was doing my makeup. And for me, that was a beautiful ritual.
Right.
It was like, I could taste the cocaine before I even did it. I could taste that vodka before I did it. That is hard to give up.
Right. And the work for us would be trying to figure out something else you could do while you're doing your makeup other than cocaine. Like, could you watch TV? Could you talk on the phone? Could you a lot of times people, lollipops or candy and things like that. So just trying to find something else to break the habit. So obviously the act of putting on makeup is still enjoyable, but you're just not doing it with cocaine and vodka.
You talk about the ritual of going from everything to nothing. What do you want parents to know about that part of it?
I think that's the way, a kid would look at it, right? I'm going, being able to go to raves, go to concerts and all these things. So you can still go do all those things. You just have to put in firm boundaries on how you're going to do it. And probably for starters, going to a concert where you've typically used a ton of drugs isn't a good idea. Will you get there in the future? Absolutely. In the meantime, it might be a good time to explore other activities and things you might like doing. Did you like playing soccer in the past? Why don't you join a soccer team? Did you like doing art before? Why don't you start painting again? Or whatever you were into. And it's really about leading a much more multifaceted life where you can find enjoyment in outside of drugs.
Do you think that relapse is stigmatized?
Absolutely. In other diseases, if you were to die or relapse, people would feel bad. If I died of melanoma, people are like, oh my God, I feel, really sorry. Ned died of melanoma. If I died of a heroin overdose, that would be tainted with a bit of, like anger, frustration. Like, why would he do that to himself? He had everything going for him. And I think with addiction, it's a disease you have to look at in a similar way. It kind of could happen to anyone. So with melanoma or cancer, the treatment is you relapse, you go back to treatment and try to fix it, and just to prevent anything bad from happening. So it's similar with addiction.
So what would you tell parents when their child relapses? I would assume it's important not to make them feel bad about it or say, right, you're a bad person because you relapsed.
When parents come in and they're like, we really don't want this to happen again. We're really scared if this happens again. I'll tell them it might happen again. But the good thing is he's here. He's in treatment. You got him plugged in with a therapist. You got him plugged in with a psychiatrist. He's taking medications and he's working on his issues. If he does relapse, he's here and he has a safety net. We can help him. Like similarly, if he had cancer, it's like we're taking an X-ray. We noticed the cancer came back up and we're going to treat him accordingly. Similarly, we're going to check his urines and make sure he's not using. And if he is using, we'll direct him to the appropriate level of care.
Relapse doesn't happen overnight, does it?
No. I mean, it could happen overnight, but it also could like bubble up over time through the course of like weeks or months. A lot of times people in recovery, they'll have like relapse dreams, which may not go away for years. So years and years clean, they're still having dreams of shooting heroin, 10, 20 years down the road. There's an interesting acronym: hungry, angry, lonely, tired. If you notice your kid, if they're not talking as much, they're more reclusive. If they obviously look depressed, they're not taking care of themselves, they're not sleeping, they're sleeping longer than they normally would, or they're not sleeping at all. They're not doing things that they love to do, whatever that is for your kid. Their energy's all over the place. If they're super energetic or not energetic at all, communicate with your kid, like what's going on. If you ignore it, you're missing an opportunity to address it and have a reasonable conversation.
What's the most important advice you can give parents when their child relapses?
When you're worried your kid may be showing signs of relapse, there's, three common themes. It's a kind of emotional relapse, it's a mental relapse, or it's a physical relapse, right? So emotional relapse is just not caring for yourself, you could say. So again, go back to the acronym: hungry, angry, lonely, tired. So you're not taking care of yourself, you're not working out, you're not eating as you should be. Mental relapse is you start waxing philosophical about how great it would be to use again. Why not use on my birthday? I could get it with having just a drink, or I could get it with just one line, fantasizing about it, calling up that old girlfriend they used to use with, calling up that old buddy you used to use with. That's more of a mental. Physical would be the actual act of relapsing, driving down to the old corner you used to go to, obviously, buying the substance that you used to use and using. Those are the three categories.
What kinds of events could lead to relapse for a young person? Like the breakup of a relationship, maybe doing poorly on a test, losing a job, that kind of thing?
When you're trying to deal with situations in your life, like a breakup, difficulty at work, or a birthday, you're flooded with these emotions that you don't necessarily know what to do with or how to deal with it. Anything that can knock you off your base, whether it's positive or negative. So it could be anything, good or bad. The idea is to maintain sobriety is you want to be able to, if you get knocked off your base, you can return. If you had a bad day at work, you process it, talk to your wife, girlfriend, husband, and then you end up back on your base. You have a great day, you get a promotion, you don't go off the rails and use because you're happy, you can end up back on your base. The important part is being able to gravitate to your base. And the reason why people get knocked off their base and relapse is because they don't have those coping mechanisms to be able to get through a good day or a bad day without triggering use. Without the substance, you can't cope with a given situation. You can't cope with good situations. You can't cope with bad situations. So the important part in recovery is being able to learn to cope and return to your base.
Can it start with the feeling of, I got this, I've been sober a few months. I got this. I'm fine. Or even a few years of that.
That attitude's problematic no matter what you do. The important part is it's a constantly evolving learning process. Your kind of like treatment plan or how you go about your addiction has to change over time because you may, start a treatment when you were 14 and your biggest worry was passing your physics exam. And then now you're like 35 and your biggest worry is, are you going to get your kids to school on time and worry about your boss and things like that. So you have to shift with the times or else things are going to remain stagnant and you risk a risk of relapse.
So there really is something to making sure that you change people, places, and things.
Absolutely. There's a saying in recovery, if you go to the barbershop enough, you're going to get a haircut. It's kind of a little cliche, but I think it speaks a lot to the importance of trying to avoid the people, places, and things that got you into trouble.
And for parents, is it a good idea to make sure that you don't have any alcohol in the house?
Yes. Or it's under lock and key, just if it can be controlled. If it can't be controlled in any other way, I'd say absolutely in the early stages of recovery, you wouldn't have any alcohol in the house if that was your kid's substance of choice. Same thing goes for pills and things like that. A lot of people have Xanax for a plane ride 20 years ago and they still have the Xanax in their cabinet. They got a tooth pulled and they still have a bottle of OxyContin. All that stuff, typically, if you're not using it, you should get rid of it. It's a really easy way for anyone to pick up an addiction. Anything can happen. People, especially kids, will experiment. Their friends tell them what Xanax is, or they Google what Percocet is, and they try it, and that could have them off to the races.
What are some of the things that parents most often misunderstand or get confused about regarding relapse?
That it's going to happen, right? So they spent X amount of money sending their kid to a residential program. Their kid was in rehab for X amount of time, getting off of whatever substance. They're clean of alcohol. They're clean of opiates. So they think they're clean. They're done. And typically that's just the beginning. That's like chapter 1 of book 1 of like a very long series. So they had 90 days clean. They went to a program. So they had 6 months clean, and then they had a drink. It's really a good opportunity when you have relapse to figure out like what led you to that point. Because when they were active in their addiction, no one was really doing that. You weren't investigating what was going on at the time. Why'd you drink? Why'd you smoke pot at the time? And so it's a really good opportunity to discuss like what was going on, what led you to do that. Granted, it could be difficult. It could be the relationship the parents have with the child that led them to relapse.
So would you recommend that parents not go it alone, without bringing in professional help?
Bringing in a third party, getting direction in terms of what makes sense, what's a good boundary to set in terms of the situation. Because honestly, if it's your kid, it's really hard to be objective all the time, right? You saw him since he's a little baby and now he's shooting drugs. So it's really hard for you to be nice and empathetic and understanding when you want them just to stop now. You don't want to pit the child against the parent or the parent against the child. It's both of them against the addiction. So it's helpful to have like an addiction expert in there as like an objective third party to say like, it sounds like you guys are having a little bit of conflict around communication. Maybe you can work on X, Y, Z. I think that's important. Step in the process so they can realize maybe what some of these triggers are. If it is the family relationship or the relationship that they have with kids at school or whatever it may be.
I would assume it's important to tell your child, okay, this is nothing to be ashamed of. This is part of the process. You are not an amoral person. You are not a bad person.
And that's the challenge because in this society, for a long time now, maybe since we banned alcohol, maybe before then, the use of substances is looked at as something you should be able to do for fun. And then when it's time to get back down to business, you should be able to stop. Cold turkey, no problems. But the reality is alcohol is an extremely addicting substance. Tobacco is an extremely addicting substance. Marijuana, cocaine, go down the list. So it's not as easy as one would think just to stop.
No, it's not. I can say for sure that it's not easy. Especially for someone whose brain is still developing, especially for someone whose emotions and hormones are all over the place.
That's a good point. And that's why cigarette companies are no longer able to target kids. That's why Joe the Camel is pretty much dead. That's why marijuana edible companies aren't allowed to use Scooby-Doo and other characters because the best time to get anyone addicted to anything is when they're a kid. If you start a habit, the earlier you start it, the more likely you are to continue it, right? So when Kobe was 8 years old, that's the good time to get him to start playing basketball. And he's going to create these great habits to become a great basketball player. Also, if you start smoking cigarettes at 8, you're going to be a great smoker by the time, you're 40, 45. So it's the same thing.
What are some of the most important things for parents to consider when they are putting together a relapse plan?
The point of a relapse plan is to set healthy boundaries between you and your kid, to understand what may happen if they do relapse, and just to have a general plan of action if that were to occur. Where they're going to go back to treatment if they do relapse, or you're going to go back to inpatient, outpatient care. I mean, depending on the severity, you may go one or the other. But I think the most important part in any relapse plan is to have that objective third party involved. So have an addiction counselor, addiction therapist, addiction psychiatrist involved to help kind of dictate the terms of the agreement. If you have a plan and it's you versus your kid, things can get a little emotional, a little heated versus someone who's objective, someone who's not at the house all the time, who says, like, you clearly look like you're doing worse, clearly look like, you need to do something. Your urine is positive for whatever substance. Let's take these steps that we outline here. So I think just like any good lawyer would keep you accountable for a contract, two parties are signing a contract, any good addiction therapist or psychiatrist will keep you accountable for a contract you signed, amongst family members.
And accountability goes both ways, right? So in other words, parents can set boundaries for their child. Can the child also set boundaries for the parents?
Absolutely. There's a phrase nowadays called helicopter parenting. When parents are a little bit too involved, you're pushing your kid and you have high expectations. And that may be an issue for the kid, and they may need a little room to breathe, a little more autonomy so they can do what they'd like to do. And I think that's what's going to get worked out in therapy with the therapist, the counselor. If the kid obviously may be unable to tell their parents that, the counselor would be able to reflect that. And the important part for the parents would be to hear that, because a lot of times you tell parents, well, it seems like you're little, suffocating Billy. Maybe you need to take a step back. He's doing what he needs to do. Just kind of let him be a little bit. And it's hard for them to hear that. In the same way, the parents expect Billy to stay sober and do X, Y, Z. I think the children can expect the parents to kind of be able to keep things in line in terms of what they want to do. And a lot of times I think kids get a lot of pressure from parents to succeed and to be successful. You want this for your child, but your child wants this for themselves. So there has to be some kind of middle ground.
Is it dangerous for parents to have expectations?
I'd say it's a mixed bag. I say it's important to have expectations. I say it's important to have high expectations. The hard part is realistic expectations. And I think that's what a therapist is there to help facilitate, right? So you might want your kid to be a rocket scientist because you were a rocket scientist, but he may have no interest in being a rocket scientist and wants to be a painter, and he's really good at painting. So setting the expectation, it sounds like you want, at the root of it, you want your kid to be successful, but it sounds like the mark that we're missing is they want to be successful at painting and not necessarily be a rocket scientist. But I think you just have to kind of see things from Billy's perspective in terms of what he wants to do with his life.
One day at a time is a very common saying in recovery. For a reason.
Mm-hmm.
What I've always been told and what I think is important for parents to know is it's important for you to stay in this moment, in this day. Your child is sober today. And that's a victory.
You really have no control of the future. We have no control of the past. All we have is the present. So I think the important thing with, like we're talking about with boundaries and everything, is to know what you're going to do today and what are you going to do today to stay sober. And anything working against that goal of staying sober today, maybe we shouldn't do it, or reevaluate it, revisit it, and figure out why it didn't work.
So important for parents to keep in mind, the past is in the past. Don't worry about the future because it hasn't happened yet.
Mm-hmm. The focus is on today. What are we going to do today to stay sober? What are we going to do today to move forward in your recovery, in your life? And that's kind of it. Everything else is a little imaginary. It's really difficult to know what may come tomorrow. So all we have is today, or right now.
You talked about the importance of being reflective.
Mm-hmm.
Why is that so important?
If you're unable to reflect on yourself and what you did, I don't think you can learn from any of your mistakes. The most difficult part about recovery, and honestly being a person, is being able to be honest with yourself about what happened, how it shouldn't have happened. And I think the only real good way to be able to reasonably reflect with yourself is to have friends and family that can be honest with you. So if you really want, like we said before, like accurate reflection, you really have to be open to taking these suggestions and being honest, like brutally honest with yourself, because that's really what it's going to take to get to the next level. Like if you're trying to master your golf stroke, your coach is going to be brutally honest, saying, your butt's out, your head's down, you need to lock your elbows. Just be able to be receptive of the information. If you're not hearing the instruction and being able to apply it, you're more than likely to repeat those behaviors over and over again.
You also told me that consistency is the most important thing for parents, that oftentimes parents will sit in your office and say, you need to fix my kid. And then they will go home and do nothing, meaning they won't hold up their part of the bargain.
I think it's important to be consistent in how you treat your child and how you deal with particular issues, right? So if you're trying to get them to stop using substances, everyone needs to be mindful of the situations that brought them to using these particular substances. So if you know your kid is more likely to use substances when you go on vacation and leave them at home for 2 weeks at a time, that may be something you may not want to do anymore, because they need that structure. They need you around. They need that attention. And if you're not around, they're going to get attention from somewhere else or something else, whether it's drugs or people. So you're really going to have to get into a rhythm that is consistent with them maintaining their recovery. It might be a change from what you're used to, but I think if the end goal is that you want your kids to be safe and sober, you have to recognize that you going away for a long periods of time isn't necessarily good for your kid. I use that as a simple and easy example, but there's so many different examples of things you could do, things you could change.
One of the other experts on the Real platform said that every conversation actually starts with listening.
Yeah.
Parents should listen to their kids.
Right. Everyone likes talking about themselves. I think the most commonly used word in the English language is I, but I think it's important to just listen, ask questions, know the who, what, when, where, and whys, and just hear them out. I think everyone's busy. Everyone has a hectic schedule. Everyone is dealing with a lot, but being able to take time to understand where your kid's coming from, what they did in school that day, who their friends are, I think is a huge one. Because more often than not for kids, they're incredibly social beings, even more so than us. Once they reach adolescence, is going to be outside the house. They're going to spend more time outside the house than they ever did before. So getting to know their friends, getting to know their friends' families, I think it is a good clue into the window of what's going on with their kids. And if they don't know that, they're missing an opportunity to understand their kids a little better.
When is the best time for a family to make a relapse plan?
I'd say as soon as they get sober. It really depends on the substance they're using. Heroin is a little more difficult in terms of detox process versus alcohol or marijuana. But I'd say the most important thing is to make a plan immediately, because the chances are they're going to relapse, and they're going to relapse soon, especially within the first 90 days. So they leave detox, they go to like a partial hospitalization program. Boom, that's when they need a relapse plan.
Is it weird to bring up with your child, hey, I know you haven't relapsed. There's a chance you will. Let's make a relapse plan.
I'd say no. At the point at which you're making the plan, chances are they've already relapsed. So they know whether they relapsed in a grander sense after they left some treatment facility, or they relapsed because they told themselves, I'm going to stop using, and they, used like a week later. So oftentimes I see people and I say, how many times have you tried to quit? And they say, it's been like 6, 7, 8 times. Or they say they never tried to quit. But they typically, if they recognize it as an issue, they always had it in the back of their mind that they were going to quit, and they couldn't stop. So I think it's easy to address that head on and from the start, because I think everyone involved recognizes the fact that more than likely this may happen again, just because of how ingrained this habit is. So having that plan from day one is essential, just so they know what to expect, and it's all written down. It's black and white. So if I relapse, I need to make more meetings. Or if I relapse, I need to make sure I take my pills, or whatever it is. It doesn't have to be too complicated. It just depends on where they're at the time.
So is relapse planning a newer thing?
No, I think it might be new in the lay public, but if you ask anyone who's been working in addictions for a long time, there's always a plan. There's always a treatment plan. There's always a goal, and there's always objectives. But I think if you talk to any therapist or group of counselors, it was always important to have a plan on what to do when things go awry. And they always have a plan. So, okay, if someone relapses, we're going to do X, Y, Z. We'll check their urine, see what they're doing, check for safety, see if they need to go to the hospital, and then reinstitute perhaps more intensive care if they need it, whether they need to go to inpatient or they need to go away. So I think there was always a plan. I think the great thing is that everyone is getting included into this plan. So the therapists aren't on this island where they're the only ones that know of it. So I think if anything changed, it's that.
I was told early on in my recovery, if you relapse, there is no shame in it. Get back to your 12-step meeting, talk to your psychiatrist, let your family and friends know. Is that something good for parents to know?
Yes, I think it keeps everyone accountable and it keeps everyone honest. And it removes the stigma of relapsing as an issue. Because again, going back to an example of something like melanoma, if I had melanoma and I had a relapse of melanoma, I would tell everyone. And it would be a way to get off my chest. It would be cathartic. I think if you relapse from, drinking alcohol and you can't tell anyone, I think it adds to the shame, and it's a lot. You're giving yourself a lot more stress, and honestly, probably repeating the cycle of maybe relapsing again by not being able to tell anyone. So I think if you can tell people, it helps for sure.
One last hopeful message for parents. Anything you want to say to the people who are on our platform, who have come for help?
I think the important thing to understand with relapse is that it's more than likely going to happen. As much as we wouldn't like it to happen, it's probably going to happen. They're going to have emotions that they're not dealing with, whether they're confronted with issues with their parents or girlfriend or at work, and they're not necessarily addressing them. They're dealing with them in a immature way where they're bottling it up or acting out rather than facing their issues head on and addressing them. Or they're letting the thoughts run away with them in terms of having these fantasies of how good using would be. They're not using their sponsor. They're not using their therapist. But when it does happen, just be understanding and know that there's people in the community ready and willing to help. You should feel supported in that whatever plan you are given is a good one. And you should feel encouraged to uphold that plan, have your kid have another day and another chance at a great life.
Thank you so much.